The Manitoba government has announced new supports for HIV care with the goal to help the most vulnerable on World AIDS Day. CBC's Zubina Ahmed has more.
Members of the Aboriginal Health and Wellness Centre performed to mark World AIDS Day. But there is an alarming trend. Manitoba has seen a 40 to 50% increase in new HIV infections each year. Michael Payne, Executive Director of Nine Circles Community, thinks those numbers will continue to rise.
We unfortunately seem on track to have up to 350 new HIV infections this year. And we have modeling that tell us that if we maintain our status quo, if we don't do something meaningful now, we'll see those rates of HIV continue to climb up to potentially 500 next year, 800 in years beyond that.
Payne mentions the high-risk groups.
In the prairies, and certainly in Manitoba, it's a different trend. We see increasingly heterosexual folks, seeing the larger representation of new HIV infections. Very often, women, 50% or more of new infections lie within women in Manitoba. Indigenous folks are overrepresented in those stats.
Taking this into consideration, Health Minister Zoma Asagwara announced launch of the program to access treatment for HIV and support, or PATHS. PATHS will provide outreach services to people with HIV in faraway communities.
Through PATHS, community-based teams go into the community to provide intensive case management to ensure clients remain connected to their treatments and other critical supports.
Asagwara also announced a new mobile care service to provide Indigenous-led care to people who are homeless. This service will be run by the Aboriginal Health and Wellness Centre. Director Colleen Ottertail says this will benefit the community.
We will be able to go to them. We will meet them where they are at. So we'll take our services and we'll go to encampments. Some of these people haven't had a chance to be in the healthcare system, and when they are, they're not treated very well.
Also in honor of the late Dr. Dick Smith, a pioneer in HIV/AIDS treatment and education, a postdoctoral fellowship will be created. Asagwara also announced funding of more than $500,000 for the Manitoba HIV program and more than $250,000 for the mobile care services. Zubina Ahmed, CBC News, Winnipeg.